Now I invite Dr. Merine Paul. Again, she needs no introduction. She'll be talking about managing patient expectations. Over to you, Merine.
Yes, thank you very much, Suchitra, for having me here. Now, having said that, can I have my slides, please? Yes, thank you. Right at the beginning, I said, see, communication is about saying the same things in different ways, right? So, whatever we have already talked about, I'm going to rehash it, but in a different way. So, you know the current climate, there is a lot of mistrust. Medicine was a top down, that means the doctor was looking down like this at the patient. Now we are hoping for a level field, but now literally actually we are looking up. So, this is the change which has happened. So, be aware of that. And why is patient satisfaction and outcomes important? Because I think Sujitra showed in the first slide, this has a very great importance or a great impact on our outcomes, not only in terms of financial but also in terms of patient satisfaction and all the other metrics that we nowadays put into practice. Now, George Bernard Shaw, all those days back, had said that the single biggest problem is in communication is the illusion that it has taken place. You think it has taken place, and for them, they are completely at sea. So, what is important is that you are setting expectations right at the beginning of your. So, see, I will be talking to you from a perspective of a cataract and a glaucoma surgeon. So, mostly it is like, it can be anything, like any part of ophthalmology that you're doing. So, start from the expectations that they can, the outcomes that you are going to promise them. So, especially when you're dealing with surgical problems or processes, or even, simply even a spectacle, you have to give them a clear idea of what are the expected outcomes and also discuss the limitations. So, this means you are setting realistic goals. Sangati കഴിഞ്ഞതിന് ശേഷം പറയുന്നതിലും it's always better that you are talking to them beforehand. So, you have to manage these misconceptions that they have. So, it can be very simple from, wearing for the first time a presbyopic glass, and they'll say like എല്ലാം പൊക്കത്താഴ്ചയാണ്. So, yeah, that is there. I mean, you have to, the misconceptions can come from anywhere. It can come from, social media, their neighbors, or, many of them, the wives will wear their husband's Kannada and come and say that it is better. So, these kind of, multiple misconceptions are there out there, and it is your job as a physician to actually address them. And again, I'm emphasizing, please discuss the outcomes with them. And you have to deal with specific concerns like the positive dysphotopsias or the negative dysphotopsias after cataract surgery is one of the commonest ones. And so you have to discuss that. Don't deny them that this is something which is, it's not important. No, validate their feelings, and you have to. So that is one way you are going to manage their expectation. And especially if you see it in the left eye, it is much higher. In right-handed patients, you can actually, when you do it, you can tell them sometimes you may feel this, so don't bother before you do the surgery. Now you have done everything well, but sometimes things go south, happens. So how would you deal with unexpected complication or sometimes like suboptimal results? So, number one thing is to reassure them, and if reassure them that yes, I am on your side, I'm trying to deal with this. So, and also you must offer them constructive solutions. I admit that there are some of them are beyond solutions. In that case, you just hold their hand and try to, like I said, if it's a posterior polar cataract, give them an idea it is not routine. So, these kind of things are very important to be, on the move beforehand. You start the process that they are aware that yes, there can be a little bit of a problem, but you always say that I'm going to handle it to the best of my ability. And if something happens, this active listening part is really very important, because active listening means, I think somebody had just talked about it. You let them vent, give them time to tell and state their process, and don't be defensive, be empathetic in your response. And empathy does not mean apologizing profusely or taking responsibility for what is not yours, but saying that I'm in your corner. And ultimately at the end of this day, you have to get patient feedback, because this feedback is what is going to give you, there may be don't always assume the problem is always with the patient. There can be problems in your SOPs. So get feedback and have continuous improvements in your processes. And as far as possible nowadays, it's much more easier as well. So many other people are there. Always get second opinion, third opinion from within your own hospital if possible, if not outside, and that spreads responsibility. And please understand patient diversity. It is not that patients are in a cookie cutter, everybody is the same, you deal with everyone the same way. Depending on their age, their lifestyle, their occupation, their expectations, their whole background may be different. Similarly, for a rural versus urban, again, the expectations and the way you deal with them will be different. Cultural and language barriers, I think Varma sir dealt with it shortly, but because of paucity of time, I'm not going to talk much about it, but can do after this thing. So when you are dealing with complex cases, please take your bail beforehand. Explain the complexity. Non-dilating pupil. Say you may have to use a pupil dilator or a iris hook. And again, take a second opinion beforehand. So if the patient goes to two people in your this thing and says, we'll deal with it. But yeah, please be aware. And then you also have to make sure that the patient is compliant. So many patients of glaucoma, you think you have communicated the importance of giving drops and putting drops, but then they will say we never understood. And so, and to avoid litigation, do be careful about proper documentation, and always, if possible, involve a senior colleague in cases which are really going really south. And final word on this is that, like I said, it is not always the patient's problem. There are a lot of people who overestimate themselves. As you have to have an idea about your skill levels, and so you cannot always say that this complication happened because the patient was wrong, or there it is a normal complication. Maybe you didn't have the skill level to start with at the first point. This is something also we need to understand. And always, don't comment on somebody else's surgery, somebody else's treatment, and avoid boasting. This is the last very important thing. A lot of people, especially the youngsters, I find, once they are in a reasonably this thing, they will be like, oh, I can deal with this, there's no problem, I'll give you the best. Especially now, that with premium IOLs and etc., you are setting up the patient expectations. Do not do that. So thank you for your kind attention.
Thank you, Merine, for that wonderful talk. You covered so many points and it was extensive.